Hey Pussy Net, new little video. This one will be a little bit serious, not that the other ones are not, but it will be bringing a little bit more emotions and stuff. And will be a little bit less information and more you'll have to do your own thinking kind of video. And the reason is that we're going to be talking about two things that I think is very lacking in some of the talks that people do on self-reliance, and actually almost never mention. I don't remember seeing a video or reading anything about that in books and stuff. And it will be the ethics and palliative care. And down I'll put a whole bunch of links, again, tools to help you take some decision. And in the disaster medicine world, there's a lot of stuff that are out there, and the problem with ethics versus a law. So basically, if I make a law, it's black and white, and so everybody knows this is the line, and if you cross the line, you broke the law. If you're on this side of the line, you're good. The problem with ethics is it depends. It depends on what you think, but then it depends on what you believe, it depends on the situation, it depends on a lot of stuff. And so basically this I'll bring kind of a little scenario, and then towards the end bring you a little bit more, hopefully, tools that you can make your own decision. So the first thing I would like you to imagine someone that you really care about, either your wife, your partner, anybody from your family, your mother, or anything like this. And imagine that you're in a self-reliant situation, so no powers, and the grid is all down and everything, and that person that you really care about is in your household. You have someone else that stays with you, either another family, or you guys you're living into a communities, and somebody else is with this person. But this other person that is with your significant other is with has more significant place for the group. So either by the knowledge that this person has. So for example, if you're in the communities, maybe the engineer or the doctor, or anyway, he has a lot of knowledge and he's very important. That person is very important to the survival of the group, either your family or either your as a community again. And the generator ran out of gas, and they go over there and you try to refuel, but weeks of not sleeping very well and mistakes can happen, and suddenly there's a flash burn, and so they get burned, and first aid is provided, just like we were talking about in our little thing. So doc rolls. I've been taught as a kid, and the fire is extinguished, but a boat, and we'll make that as an equal. And again, we won't talk much about triage, we'll talk about it in another video, but in this video, both person has exactly the same burns. They were side by side on the generator, and they get burned. And in the burning stuff, we always talk about percentage. So percentage of burns, and it's called the rule of 9. And basically, a simple way of seeing is your hand, in the hand of the person. So obviously my hand may be bigger than another hand and everything, but her hand is 1% of her body. So those two person have what we call a 20% burn, which are not significantly, but they're out there. I mean, they're it's a survival. It's in normal condition, it would be a good survival thing. But again, you're in a supplemented resource. So they get burned on their chest, legs at 20%. superficial, deep wounds. So 20% burns. There's a rule called the Parkland formula, and again, we won't go talk. I don't want to talk much about the medicine, but it's more to bring the concept of ethics, and I want to stay on that. So that's why I'm not charting about what I'm saying. So there's something called the Parkland formula, and basically is how you resuscitate most of those people because they'll go in some shocks. And the formula is basically 4 cc's or 4 milliliters of fluids times the percentage. So here 20% times per kilo. So basically, let's say they're both again 70 kilos, 4 cc's for 20, so that 80 plus times 70 kilos, and that would be a lot of fluids to give, about maybe 8 liters. I'll do quick the calculation here. So 80 times 70, yeah, so 5,600 cc's or 5.6 liters. And half of it has to be given in the first 8 hours. So we're talking about 2.3 liters of fluid that has to be given in the liters. So you did your protection, and we'll talk a little bit more about fires and stuff like this. But those 2 people will need a lot of fluid. So we're talking about here about both of them together, about 10 liters only for them, like only for this, for the initial state, 10 liters of fluids. This is without talking about the number of dressings that we'll need, and because when you get burned, even if it's deep or superficial, there'll still be superficial wounds in some place, so pain will still be there. Obviously the deep ones, a lot of time the nerve will be dead, but there's still surrounding around there that has the pain. So you'll need a lot of painkillers, a lot of pain medication and things like that. I did a course one time about the, it's called Advanced Burn Life Support, Advanced Burn Life Support by the American Burn Association. And basically they were talking about, you know, treatment of burn patients and stuff. And in one of their courses, and I, unfortunately, because of reproduction rights, I cannot print this, but I can show you quickly what it looks like. And basically it's a little chart. And what it is, it's called a survival grid, and it's per age. So basically, here as the definition, so as you see on the yellow here, is people that would have a good chance of survival. Over here, they could have a good chance of survival despite certain treatment. If you're in the purple and the blue, pretty much like you have no more chance. So basically here, so as you can see, again, it would have been fun to produce, but so 11 to 20%. Yeah, sorry, 11 to 20%. So they're in this category. There are 2 patients. Let's say in their age they're between 30 and 40. So that would be around here. So again, they're in this category. So in the high category. So survival and good outcome expected. Survival greater than equal to 90%. With limited or short-term initial admission and resource allocation less than or equal to 14 days. Maybe 1 or 2 surgical procedures. So the outcome could be good, but you would need maybe some resource to do it. Now, you got 2 patients, and both of them will eat a lot of your resource. And this is where the ethical questions start to wonder. Do you treat them? Yes, you heard correctly. Do you treat them? We said that, for example, if you decide to treat both of those patients, that would be 10 liters of whatever saline. Let's say you're an IV believer. That would be 10 liters just in the first 24 hours to give to those people. 10 liters of fluids that you just give to those people with a good chance of survival. But do we give 10 liters of your supplies. Without even talking about, again, dressings that would need to be changed, depending again what kind of dressing. We'll talk a little bit later in further videos, what kind of dressing you would have to change for that. Then you would have to give a lot of pain controls for those 2 people. So again, depending on the limitation of what your resource on pain controls, you have now to provide this. You have also need to provide a good sterility, because those people will be at high risk of infection, especially in an environment where they'll be outside and everything, and it'll be hard to keep sterility. So now they're at risk for infection as well. So here's the question again: do you treat those people? Here, according to this graphs, they have a high risk of things, but you're losing a lot of resource. So do you give all your resource to 2 people, and maybe down the line, so let's say you have to survive or provide medical care for 6 or 7 months, do you provide the care to all those peoples? Maybe we're talking about 5 or 6 or even 10 people down the line. Maybe they took all the care that they need. So for example, those 10 liters that you give it, that, let's say by 2 liters, that's 5 people. So now you help 2 people in less than 24 hours, despite all the other fluids that you will need to provide them to continue their care. And that's without even considering all the complication that you may have by having fire and by burn and everything. Again, we'll talk about it in another video. But you have given 10 liters of fluid. So let's say for normal people that is usually dehydrated, you would have to give between 1 and 2 liters of fluid to those people. So now it's 5 people, because you have 10 liters for 2 people. So 10 liters for 2 people, or 2 liters for 5 people, that could become more useful for your thing. So let's say you say, okay, I'll treat one of them. Who do you treat? You have one person that serves the good of the community or the group because of the knowledge or whatever importance, and you have the one that you care for. So meaning, like, the person that you really like, it's your wife, it's your partner, it's one of your best friends, is the person that you share a lot. It could be your parents, it could be anybody. It's somebody that you care with. But the other person will make you survive again for the big groups. So as you can see, we're starting to get into decisions that won't be easy to make based on the care. And so we'll cut on this video, and we'll continue part 2, but this time we'll start continuing more on the discussion of the choice that we may have to do.